welcome to Eugene Speech-Language Therapy. I'm Sierra and this is Waffles. Today I wanted to talk to you about right brain injury. So our brains have two hemispheres, a left hemisphere and a right hemisphere. In most people, the left hemisphere is where the language center is and the right hemisphere is where other centers are. A lot of our cognitive centers, so memory, attention, visual perception, planning, sequencing, personality, things like that. There are a lot of different ways you can have a right brain injury. It's essentially any assault to the right hemisphere, and that can be a tumor or a stroke or something traumatic happening like hitting your head, an infection. One of the most devastating things I see when I work with people who have had a right brain injury is their personality changes, or you have mood swings. Once a family member has had, let's say, a stroke that affects the right hemisphere and their personality changes, it's a big blow and it's surprising for people and it's hard for them to deal with. So it's important to realize that it's not the person's fault. They're not trying to do it. We just have to work with them and understand that they're going through something and they may never quite be the same. More specifically, changes that can occur with a right brain injury. Memory, that's your ability to recall things in the past. A lot of the time it's short-term memory loss, so learning new information is difficult. Attention, having difficulty in paying attention, especially with distractions. So people with right brain injury may do better in quiet environments, focusing on one thing at a time, possibly just giving them one direction at a time or one piece of new information at a time. Visual-spatial deficits, so a lot of times their left visual fields will be cut and they'll have to be retrained to look left. That could mean either in reading a piece of paper, they won't even see this side of the page, or in a room, if you're standing to the left of them, they may not see that you're there, and so they have to be trained to look left. Reasoning and sort of abstract thought, problem solving, safety awareness, those things can also change. You have to rework through these situations relevant to the person in order to get these skills back. Someone with a right brain injury could be disoriented. That could mean place and time, not knowing where they are and not knowing why. So things that can help that are visual cues, giving them a little book that says this is what's going on, this is where you are, teaching them to look through that book periodically. Things like that can help. Thank you so much for watching. I hope this helps you to understand right brain injury. Please check back for my video next week.